Essentials of Counseling. Dr. Soumya will moderate this session. The next topic will be Clinical Establishment Act by our youngster from Chennai, Dr. Amal Raj. The other moderator will be Dr. Sudashna Skanda from IAP Tiruchirappalli. So over to you, moderators.
Thank you, sir. Good evening, everybody. It's my pleasure to introduce Dr. Ismail, who's the incoming president for the year 2021. He was a past president of our IAP Coimbatore City branch. He is an active poet Rotarian in Metupalayam. And for people who know him well, he is a poet for any occasion. He has also got many other talents, one of which is lockdown chef. He has got a fantastic sense of humor. And it is over to you, Dr. Ismail, for counseling with a smile.
Good evening, all of you. Thank you, Dr. Soumya, for your nice words. President Dr. Sendal, Secretary Suresh Balan, Rajendran, and my dear friends in the IAB. I am happy to deal with you today the essentials of counseling. As far as the smart clinic is concerned, though everything matters, every tiny thing matters, like space, location, gadgets, the information you provide, digitalization. But at the end of the day, what matters is how the doctor speaks and how much time he had spent with the patient, what way he had explained the illness, and finally, of course, how much he has charged for the time he had spent. In this era of litigations, when people go to the court and of course read reviews and comments in the social media and having a half-baked knowledge from the Google, the success lies in how we speak. Every individual has got his own style of talking, giving different examples, and in our own ways of convincing the patients. I do remember when I was working in Masonic, there was a patient with post-encephalitic sequelae in the ward. Our boss, Dr. M.R., used to walk in and he used to talk with the patient like this. The patient was from native village and a lot of crowd was there. The way he spoke is still vividly in my mind. He said, Amma, இந்த பாப்பாக்கு இருதயம் நல்லா வேலை செய்யுது, நுரையீரல் நல்லா வேலை செய்யுது, மூத்திரம் பிரிக்கிற அந்த மூத்திரக்காய் நல்லா வேலை செய்யுது, குடல் நல்லா ஜீரணிக்குது, எல்லாம் நல்லா இருக்குமா. ஆனா அந்த மூளை மாத்திரம் கொஞ்சம் பிரச்சனை, அவ்வளவுதான் அப்படின்ட்டு அவர் போயிட்டார். The next moment, the medical officer went inside to get DIL. The entire crowd ஏப்பா அந்த மகாராஜா எல்லாம் சொல்லிட்டு போனாரு, எல்லாம் நல்லா இருக்குங்கிற, நீ என்னமோ ஆபத்துன்னு சொல்றிய. This is how the patient perceives in a different angle, and we should be very careful in counseling. Similarly, I do remember vividly one more example saying, sometimes they talk irrelevant. We think patients talks irrelevant. My OG professor used to tell me, once I asked the patient, I just want to calculate the EDD. எப்பமா உனக்கு லாஸ்டா தூரம் ஆச்சுன்னு கேட்டேன். The patient replied, எம்ஜிஆர் செத்த அன்னைக்கு. So எம்ஜிஆர் செத்த டேட் வந்து அவங்களுக்கு சிக்னிஃபிகண்டா போச்சு. But நமக்கு அது it is also equally significant because we want to calculate the EDD. நம்ம எம்ஜிஆர் அன்னைக்கு செத்த பார்த்து டேட்டை வச்சு கால்குலேட் பண்ணணும். So before counseling, I think it is an art. I think you people should really understand, as this slide says, most people do not listen with the intent to understand. They listen with the intent to reply. அப்படி இருக்கக்கூடாது. அவன் என்ன சொன்னாலும் முதல்ல கிரகிக்கிற தன்மை நமக்கு வரணும். We should understand first ourselves the words of the patient clearly and then use our wisdom and then counsel them. However, one has to learn that if we adopt certain principles and talk in a better way so that it gives them confidence and also a sense of satisfaction that matters a lot. This is my small attempt to say the effective nature of counseling. First, keep the area comfortable and well ventilated. Keep your face bright. வீட்டில் இருக்கிற மாதிரி வேண்டாம். Wear an attire that pleases children and of course the mothers. Lady doctors, no problem.
ஏப்பா
அவங்க எது போட்டாலும் அழகா இருப்பாங்க. நம்ம கொஞ்சம் கரெக்டா இருக்கணும்.
சூப்பர் சூப்பர்
Please.
Dr. Selva, please mute.
அப்படியே கொரோனா வாங்கிட்டு.
Dr. Selva, please mute.
Next, Tirumurugan.
Selva.
So the counseling, basically, counseling பண்றதை விட what is not counseling first நம்ம தெரிஞ்சுக்கணும். The first thing is giving advice. Nobody likes it. When you give a big list and say not to do this, majority, even in kids also, நம்ம என்ன தப்பு பண்றோம்னு சொன்னா, we always teach not to do. உட்காராத, பேசாத, ஒரு kindergarten குழந்தை கூட keep a finger on the lips, don't talk. அவனுக்கு யூரின் போகணும், but we say only in interval, please stop. Don't do தான் நம்ம சொல்லி கொடுத்துட்டு இருக்கிறோம். Generally we say we don't teach them what to do. So அதனால advice போட்டு நம்ம தாளிக்க கூடாது. And we should not become judgmental. நம்ம அவங்கள பத்தி ரொம்ப திங்க் பண்ணி இவன் இப்படிதான் நம்ம ஒரு prefix ஐடியாவோட அவங்க கூட பேச ஆரம்பிக்க கூடாது. And we should not attempt to sort out their problem. Their problem should be sorted out by themselves. And only thing we should guide them, we should give ways to sort out. And I think you need not expect your patients to behave the way you think. இப்படிதான் இருக்கணும் அப்படின்னு நம்ம அந்த பேஷண்ட ஒரு defined mannerல நம்ம நினைச்சிட்டு இருக்க கூடாது. And don't get emotionally involved with the patient. Next slide, please. So let me go ahead with this. What are the key counseling skills? There are about 11 qualities in that, 11 phrases. I go each one by one. The next slide. Attending. What do you mean by attending? You should understand the patient that you are attentive. So please, when the patient starts talking, prepare to listen in an unhurried way. நம்ம மொபைல் பார்த்துட்டு இருக்கிறது, வேகமா அடுத்த பேஷண்ட் இருக்காங்க, 30 பேர் இருக்காங்க, I just want to rush through, I came late to the clinic. Don't show your body language, don't show a bit of hurriedness in your approach. Just be cool and listen, make them feel that you are listening. And you should have an appropriate eye contact. As Tirumurugan said, அவர் எவ்வளவு கஷ்டப்பட்டு எல்லாத்தையும் பண்ண பிறகு that lady finally said to him, சாமி நீ என்ன பண்ணனே எனக்கு புரியல. Not like that. I think you should have an appropriate eye contact and your body language should be very pleasing for them. And you should always add some affirming verbal. அப்படின்னா ஏதா சொல்றப்ப ஆஹா ஓ அப்படிங்களா என்ன ஆச்சு, what happens, some suffixes, some small words to encourage them speak. So that will always help you to counsel them in a good way. The second is rapport building. How do you build a rapport with the patient? First, you should be cordial to them, receive them in a different way. You should be warm and genuine, and you should be respectful. You should be respectful, and you should be empathetic as well, and you should not be non-judgmental. Next slide, please. Another important counseling skill is silence. நிறைய இடத்துல இந்த silence work பண்ணுங்க. You're at home. When you quarrel with your wife, the silence matters a lot. For a person who is in the young guys who make really involved in the romance, of course, the silence matters much to them. Especially, am I audible? Something is disturbance there? Hello?
We are wearing all the masks.
Hello? Tirumurugan, am I audible?
You are audible. There is some disturbance. One of the participants is not muted.
Okay. Silence is a very essential and a needed skill. Being quiet and allowing the patient to speak They will be very fluent and they will be very comprehensive and they will be clearly telling the story to you. And if you are really receiving with utmost patience, it makes them feel heard, and of course they feel validated. And of course, when you receive the messages, when you listen to them properly, it will really make you understand about the real problem of the patients. And it really gives you a space to analyze and then reply. Next slide. This is an important quality in counseling. What is paraphrasing? The paraphrasing, when the patient speaks to you, it gives you certain very stories சொல்லுவாங்க அவங்க. எப்படி சொல்லுவாங்கன்னா, நேற்று நான் போனேனுங்களா, மழை பெஞ்சுதா, அங்கே போய் என் குழந்தை நினைஞ்சிடுச்சுங்களா, அப்புறம் போய் அங்கே பஞ்சாமிர்தம் வாங்கணும், அது வாங்கணும், சம்திங். The story may be totally irrelevant. But நம்ம அவங்கள லிசன் பண்ணி போகணும், அட்ராக்ட் பண்ணணும் அப்படின்னு சொல்லியிருந்தா, we need to tell them in their own words. That is called paraphrasing. Reflecting back the key points. For example, next slide. See, this is an example for a paraphrasing. The patient is telling it, my father is ill and I'm worried. He lives a long way and I should reach him by train only and I don't have money to buy a ticket. நம்ம அதை அவன் ரொம்ப ஒரு இருக்கிறப்ப நம்ம எம்பத்தட்டிக்கா அப்ரோச் பண்றப்ப paraphrasing எப்படி பண்ணணும் அப்படின்னு சொன்னாக்கா, we just tell them, we need not repeat the same words and paraphrasing இல்லாம, we should say them, you are concerned about your father's health and it seems you have money worries too. Okay, go on. When you encourage like that, they will really come out with their clear picture. Next slide, please. Again, the other counseling skill is reflecting. Paraphrasing and reflecting is not much of a difference. That's wonderful. Paraphrasing, you are repeating the same words, but here you pick up the emotion. What is the emotion? See, here, what is the example is, the patient is really suffering. He comes to the counselor or a doctor and says, I don't know why God has done this to me. It is disgusting. And then you have to be, you have picked up, he's angry with the God. When you say that, he always say, oh right, doctor ko purinjiduchu, something like that. Then he acknowledges our reflecting skill. And of course, the other skill we need to have is empathy. Empathy is nothing but listening to the music behind the lyrics. I think you need to walk in his shoes. அவனோட பர்வியூல, அவனோட ஆங்கிள், அவனோட கஷ்டங்களை உணர்றது, the way he perceives the problems, the way he undergoes the trouble, the way he perceives the pain, all need to be understood. And I think you need to speak from that angle. So when you express the regard and the respect to the patient, understanding their point, that will be really taken up by them and they will feel happy to really converse with you in a nice way. Next skill. I think you should be focused. See, out of a long list of complaints or a long story they tell, sometimes we need to pick up. See, in the busy practice, seeing about 40 odd patients a day, sometimes we tend to forget why we have written this investigation to this patient. When the patient comes at the 35 number or so and then shows the urine, we didn't know really whether we sent it for a jaundice or a UTA or whatever it is. Sometimes we tend to forget out of our own busy practice. So that should not be there. I think we need to focus in our approach, and we should need to focus where exactly the problem lies in the story and how to pick up that and then analyze and then reply and talk and convince them. Next. The clarifying. I think whenever you do a counseling, you need to clarify. Without understanding, please don't counsel them. Without knowing the facts, please don't talk to the patient. End of the day, what matters is how you have spoken to him. That is the matter the patient takes home. So we need to be very, very careful in that. So needs relevant questions and appropriate questions. So you need to ask him what exactly gone wrong, what is the duration. And when he says in a erratic way and you want to pick it up correctly, you can ask him to be specific. You need to sort out which is significant, which is not significant. That all is much important in a counseling. Next slide, please. So the patient may be asking a lot of questions. And as a counselor and a doctor, health professional, I think you also should have certain form of questioning when it needs to understand the problems. The questions may be an open-ended question, open questions. What do you mean by open question and what do you mean by a closed question? Open question is, how are you feeling today? What is your problem? And how long it has been there? But closed question is like, when you put this question, they'll answer in a one word. Open questions make them to stimulate to talk. So that the questions you should use it very carefully and cleverly. And the last skill is immediacy. The way we signal closeness using a plural words. For us, நமக்கு இப்படிதாங்க இருக்கு, கொரோனா எல்லாருக்கும் பயமா தான் இருக்குங்க, எங்களுக்கும் பயமா இருக்கு. When we include ourselves into the situation, what they experience nowadays, they become more friendly. So that is the quality in counseling, that we need to be binded with the patients and perceive their problems as our problems. So basically, counseling, I think it is a very important tool in a smart clinic. Once you master counseling, I think you can become a master at home too. Probably you need to take up this skill so that you can become so well versed that you can counsel your wife and lead a happy life. Thank you.